I see this quiet concern in my clinic every single week. It's a topic wrapped in confusion, silence, and sometimes a fear that this is just an inevitable, permanent sign of getting old. I'm Dr. Julian Reed, a board-certified urologist. My role is to help men understand their bodies, separate myth from medicine, and navigate these changes with clarity and confidence. This video is for educational purposes only and does not replace personalized medical advice from your own doctor. Today, we're going to explore what this change might mean for your overall health, why it's happening, and most importantly, what you can do about it. This isn't about performance, it's about health, vitality, and maintaining your long-term independence. First, let's understand the biology in plain English. Ejaculation is a complex, coordinated event involving your nervous system, hormones, blood vessels, and muscles. As men age, several natural shifts occur that can affect this process. Think of it like a finely tuned orchestra. Over time, the instruments might need a bit more tuning, and the conductor's signals might soften. Hormonal changes. Testosterone levels naturally and gradually decline. This hormone is a key conductor for libido, muscle mass, and overall energy. Lower levels can mean the initial interest or drive may decrease. Circulatory health. Erections and the ejaculatory reflex depend on robust blood flow. The health of your blood vessels is paramount. Conditions like hypertension, high cholesterol, or early-stage vascular changes, which are very common with age, can reduce the efficiency of this system. Neurological factors. The nerves that signal pleasure and trigger the reflex can become less sensitive or slower to transmit signals. This can be influenced by general health, certain medications, or age-related neurological changes. Prostate health. The prostate gland produces a significant portion of seminal fluid. As it enlarges with age, a condition called BPH, it can affect the force and sensation of ejaculation. Some medications for BPH or other conditions are also known to affect ejaculation. The use it or lose it principle. From a purely physiological standpoint, regular sexual activity and ejaculation help maintain healthy blood flow to the pelvic region and support prostate health. A long period of inactivity can, for some men, make resuming function more challenging. It's about maintaining the pathways. The key takeaway here is this. A change in ejaculatory function is rarely just one thing. It's often a signpost pointing to the broader state of your hormonal, vascular, and neurological health. It's not a verdict, it's information. Here's what most men are never told in the locker room or the doctor's office. Your body retains a remarkable capacity to respond and adapt, no matter your age. Your body retains a remarkable capacity to respond and adapt, no matter your age. The systems we just talked about, circulation, hormones, nerve signaling, are influenced daily by your lifestyle choices. In my clinical experience, when men understand these connections and make targeted, consistent adjustments, they often report significant improvements in their overall sense of vitality, confidence, and yes, in their sexual health. The goal isn't to recapture your 30s, but to optimize your 60s, 70s, and beyond for strength and independence. This is about supporting your body's inherent ability to function well. If this perspective is resonating with you, I'd appreciate it if you'd hit the like button on this video. It helps the YouTube algorithm show this important, science-based information to more men who could benefit from it. Let's break down the practical steps. These aren't quick fixes. They are foundational health principles that support the entire system. 1. Prioritize circulation support. Authority. In my clinical practice, one of the first things I discuss with patients experiencing changes is the state of their vascular health. Science. Every organ and function, including sexual function, depends on oxygen-rich blood. Plaque buildup in arteries, atherosclerosis, doesn't just happen in the heart. It affects the entire body, including the small vessels in the pelvis. Benefit. Supporting healthy circulation is associated with better erectile function, more robust orgasmic sensation, and overall cellular health. Action. Focus on consistent, gentle cardio. This isn't about running marathons. A daily 30-minute brisk walk, swimming, or cycling can significantly support vascular health. The key is raising your heart rate moderately and consistently. 2. Review your medications with your doctor. Authority. This is a critical and often overlooked step I review with every patient. Science. Several common medications can affect sexual desire and ejaculation as a side effect. These include some antidepressants, SSRIs, blood pressure medications and prostate medications like alpha blockers for BPH. Benefit: a simple medication review may reveal an adjustable factor. Never stop a medication on your own. Action: schedule a consultation with your primary care doctor or urologist. Say, "I'd like to review my medications and discuss if any could be affecting my sexual function. Are there alternatives we could consider?" 3. Support healthy hormonal signaling. Authority: managing stress and sleep is non-negotiable in my treatment plans for hormonal balance. Science: chronic stress elevates cortisol, which can disrupt testosterone production. Poor sleep severely impairs the body's natural hormone release cycles, including growth hormone and testosterone. Benefit: better sleep and lower stress may help support more stable hormone levels, improving energy, mood, and libido. Action: protect your sleep. Aim for 7 to 8 hours in a dark, cool room. For stress, adopt a simple practice: 10 minutes of deep breathing, meditation, or even quiet time in nature daily. Consistency trumps duration. Many men your age quietly deal with this. Comment yes below if this information is helping you understand your own situation better. 4. Nourish with prostate and vascular healthy foods. Authority: I always emphasize that diet is a form of daily medicine, especially for urological health. Science: a diet rich in antioxidants, healthy fats, and specific nutrients supports prostate cell health and reduces inflammation, which is a key driver of vascular disease. Benefit: this dietary pattern is associated with supporting prostate comfort, healthy blood pressure, and reducing systemic inflammation. Action: increase your intake of cooked tomatoes, lycopene, fatty fish like salmon, omega-3s, nuts, seeds, and colorful vegetables. Reduce processed sugars and refined carbohydrates, which can spike inflammation. 5. Re-engage gently and without pressure. Authority: I counsel patients to reframe intimacy, focusing on sensation and connection rather than performance. Science: anxiety and pressure are potent inhibitors of sexual response. By removing the goal of ejaculation, you reduce mental stress, which can paradoxically help the body's natural reflexes function. Benefit: this approach may help reduce performance anxiety, increase intimacy, and allow for natural function to return without force. Action: with a partner, focus on touch, massage, and connection without expectation. If alone, explore self-stimulation gently, without the pressure to climax. The goal is to reacquaint yourself with pleasure and blood flow to the area, not to achieve a specific result. Now let's turn these insights into a dignified, sustainable plan specifically for men aged 60+. I hear this often. "Doc, am I too old to start? Did I wait too long?" The answer is a respectful but firm no. In my clinical experience, the men who do best start by building a stable, gentle foundation. Your body responds beautifully to consistency, even more so now than to sporadic intensity. Sleep timing: go to bed and wake up at the same time every day, even on weekends. This regulates your circadian rhythm, which governs hormone release. Gentle movement: embed movement into your day. Park farther away, take the stairs, do 5 minutes of stretching in the morning. The goal is to avoid long periods of stillness. Regular meal timing: eat your meals at consistent times. This stabilizes blood sugar and energy levels, preventing the slumps that drain motivation. Small, steady habits are the bedrock of health at this stage. They signal safety and regularity to your body. This is about working with your body, not fighting it. We support the systems we discussed. Hydration: sip water consistently throughout the day. Dehydration thickens blood and stresses the kidneys and prostate. Aim for clear or light yellow urine. Sustainable nutrition: don't overhaul your diet overnight. Start with one change. Add a large serving of vegetables to one meal each day. Once that's habit, add another. Stress management: age-appropriate for many of my patients. Stress is about loss of control or purpose. Counter this with mastery. Pick a simple, manageable skill: gardening, woodworking, learning a language, and practice it consistently. This builds a sense of agency that directly counteracts anxiety. Common mistake: men often try to change everything at once, become overwhelmed, and quit. Pick one item from the solution breakdown, say the daily walk, and do only that for 3 weeks. Master it, then add another. Your mental state is not separate from your physical health. Confidence affects posture, breathing, stress hormones, and yes, sexual function. Why confidence matters: when you feel capable and independent, your nervous system is in a state of safety, not threat. This is the optimal state for all bodily functions, including sexual response. The role of routine. A predictable daily routine drastically reduces low-grade anxiety. Knowing what comes next frees up mental energy and creates calm. Measuring progress without pressure. Throw out the numbers. Instead, ask yourself, do I have more energy in the afternoon? Is my sleep more restful? Do I feel more engaged with my life? These are your true metrics. Reinforce your identity. You are not broken. Your body is still responsive. It is adapting as it always has. This stage of life is about wise stewardship, not decline. Progress now is quiet, steady, and deeply meaningful. It's the confidence of knowing you are actively caring for yourself. If you take just these steps and stay consistent, you're giving your body the respect and support it deserves at this chapter of life. If this conversation has brought you clarity or hope, please support this channel. Like this video. It tells YouTube this is important content for men's health. Subscribe to Dr. Julian. I'm here to be your trusted resource for prostate health, hormonal balance, and living with vitality and confidence at every age. Join the conversation below. It helps us build a community. Join the conversation below. It helps us build a community. You can comment with your age range, e.g., 60s, 70 plus, or simply type ready if you're committing to taking a thoughtful step with your health today. Remember, seeking understanding and taking proactive steps is a sign of strength. You deserve clarity, strength, and confidence at every stage of life. Take care, and I'll see you in the next video.